How to cope with hair loss from cancer. How can someone cope with hair loss caused by cancer treatment? This is a common concern for many individuals undergoing therapies for testicular, cervical, and other reproductive cancers. Understanding the causes of hair loss, managing the physical changes, and addressing emotional impacts can make a significant difference. Hair loss often occurs due to treatments like chemotherapy, radiation therapy, and hormone therapy. Chemotherapy targets rapidly dividing cancer cells, but also affects healthy cells, particularly those in hair follicles. This leads to a condition known as chemotherapy-induced alopecia. Typically, hair loss starts about 2 to 4 weeks after beginning chemotherapy and can affect not just scalp hair but also eyelashes, eyebrows, and body hair. The degree of hair loss can vary based on the specific drugs used and their dosages. Radiation therapy can also cause hair loss, but this usually happens only in the area being treated. Hair loss may begin 1 to 3 weeks after starting radiation and can be long-lasting or even permanent, especially if the head or neck is involved. Hormone therapies, such as tamoxifen or aromatase inhibitors, often lead to thinning hair rather than complete loss, and this is usually reversible after treatment ends. To manage hair loss, there are several practical strategies. One option is to use scalp cooling caps during chemotherapy. These caps work by constricting blood vessels, which limits the amount of chemotherapy drugs reaching the hair follicles. While these caps are approved by the Food and Drug Administration, they may not be available to everyone due to cost or accessibility. Gentle hair care practices can also help. Avoiding harsh chemicals, heat styling, and tight hairstyles can minimize further damage to hair. Many people find comfort in using head coverings such as wigs, scarves, hats, or turbans. These can help protect the scalp and maintain self-esteem during treatment. Some treatments, like minoxidil, are being studied for their potential to promote hair regrowth. However, these should only be used under the guidance of a healthcare professional. Emotional and psychological support is equally important. Hair loss can impact body image and emotional well-being, so open communication with healthcare providers about these feelings is crucial. Joining support groups or seeking counseling can provide valuable coping strategies. Planning ahead by discussing potential hair loss with the care team can help prepare both mentally and practically. After treatment, hair usually begins to regrow within weeks to months, although the texture and color may change temporarily. Patience is key, as regrowth varies from person to person and depends on the type of treatment received. Because the risk of hair loss and management options can differ based on cancer type and individual circumstances, it is essential to consult with an oncology team for personalized advice. Avoiding unproven treatments that lack scientific support is also vital to ensure safety and effectiveness. In summary, coping with hair loss from cancer involves understanding the effects of treatment, utilizing preventive measures, addressing emotional impacts, and seeking tailored guidance from healthcare professionals. This comprehensive approach can help maintain quality of life and support adherence to cancer treatment.